Hi, I'm Dr. Roger Owens with HealthQuest Physicians Group, and this is a Minute to Better Health. It's a new year and you've started in on your exercise program. All of a sudden you start noticing that you're experiencing foot pain due to the increased activity of walking, running, exercise. Your feet tend to throb at night when you try to go to bed. When you get up in the morning and you take those first few steps across the floor, your feet feel like you're walking on eggshells. It's a very painful condition and it's called plantar fasciitis. This is one of the more common conditions that we treat. The proper treatment for plantar fasciitis is correcting the underlying structural problems. When the arch begins to fall in the foot, it pulls on all that tissue and that creates inflammation, it creates pain, and it's miserable. Now, in order to fix it, and fix it right, you have to have an orthotic that is fit properly. It has to capture the arch potential of the individual. It has to be based upon your weight because it has to give slightly in order to be comfortable to wear. And it also has to be based upon your activity level. If you're a long distance runner and you're using that arch quite a bit more than, say, a desk worker, then it needs to be built with that in mind. Now we cast for these, and these are the ones that we use in our office. They're called sole supports. These are the best orthotics that I've come across. If you have any questions, please call our office or check our website. We've got additional information there. Please share this video with somebody you feel could benefit from this or give us a call. Thanks for watching.